the South African population demographically is obviously younger than the Australian population. We do have to be concerned about the vulnerability of our citizens. Of course we do. But the answer is not snap lockdowns. The answer is not increased restrictions for COVID-19. The answer is a booster blitz, which is exactly what we're going to do. You know, I called the more senior members of my own family earlier today just to check in when their booster's due, and I'm going to get mine too within the coming days.
Yeah, I had mine a couple of days ago. How important are the boosters in limiting transmission of Omicron, and is the 5-month interval between the second and third doses the right amount of time?
Well, certainly there's a good reason for bringing it down to 5 months. There will be debate about whether it needs to be brought down even further. And I can tell you that our Australian Advisory Group on Immunisation, ATAGI, is going to be looking at that on a day-by-day basis. But my message is for those Australians who are eligible now, get out there, roll your sleeves up and get the boosters. There's actually plenty of availability. I can tell you that there's a member of my family who got into their pharmacy in Sydney tomorrow for an mRNA vaccine. So I think the concerns about availability are probably a little bit overblown as well. The vaccines are available and we've got the mechanism to roll them out through our current program.
The New South Wales Premier wants the focus to be on hospital admission rates rather than case numbers. We know there's a 2-week lag in testing positive and then potentially going to hospital. We haven't, as a country, yet transitioned in our mindset, have we, to focus on hospital numbers rather than case numbers?
No, we haven't. And I think we're being held back by some medical commentators who really insist on us focusing on case numbers. And I think that's pretty disappointing that they've been unable to move forward as this pandemic has evolved. We need to be leaders of the community. We need to bring our community forward without fear and with as much fact and evidence as we possibly can. And I think that means that we do need to focus on hospitalisations and getting ourselves boosted. And then, you know, the most modest restrictions we can possibly have to then go about living our lives as freely as we possibly can. There would be a different story, of course, Karina, if we were at the start of this pandemic. But we're 18 months into it and the equation has to be different now.
Yeah, and having said that, the Prime Minister says it's now time for governments to step back and allow individuals to take charge of their own lives. That's very much in line with what the New South Wales Premier Dominic Perrottet has been saying. What do you make of those comments?
Well, I think, you know, people on a certain side of politics will interpret that as being a very sort of libertarian type of view. But if you talk about it from a public health ethics point of view, what we need to understand is that we've done about as much as the public will tolerate now in terms of significant restrictions on their ability to live a full and free life. And you know, we have to, in the face of a variant that's milder but more infectious, we can't go on with the suggestion that we're going to have snap lockdowns, that we're going to interfere with people's lives. And obviously, if people are concerned, then I guess what the PM and the Premier of New South Wales are saying is they are free to be concerned and they are free to take extra measures if that is what they want to do. But I think from my personal perspective, I don't think the Omicron variant warrants too many extra measures other than getting yourself boosted and making sure you get yourself tested if you're symptomatic, and otherwise enjoy the Christmas break.
We're both West Australians, and we've spoken about WA's extreme risk category before, which New South Wales has now been designated once again. It doesn't allow for entry for compassionate reasons, and you called it a political decision the last time we spoke. It comes after WA announced its reopening date of February the 5th, and its over 12s population is now more than 80% fully vaccinated. So can a decision like that be justified?
No, it can't. And I mean, I think the problem I have there is I have no problem with the border controls until February the 5th. But to suggest that travel for compassionate grounds should be curtailed because of what's going on in New South Wales, it's worse than just a tenuous position. I think it's actually a fundamental abuse of someone's rights as an Australian. I mean, if someone needs to get into Western Australia for a significant life event where a member of their family might be seriously unwell, then I think they should have every opportunity to be able to do that. Government can facilitate it, to suggest that it's not safe, with all the resources of government that could support testing, that could support someone in home isolation and call them. And, of course, you can manage compassionate access for West Australians wanting to go home.
Now, there was an exchange on News Breakfast this morning that I want to get your reaction to. I think we can play it now.
I've just seen a tweet from Dr. Nick Coatsworth, who, as you know, is the former Deputy Chief Medical Officer of Australia. This is what he said, and he's related it to the AMA's statement about Omicron. 3 weeks into the Omicron variant, the Peanut Gallery Association, as he describes the AMA, decides we're behind again. How are those memberships going, he asks. What do you make of that?
Well, what I'd say is that the thing is, what do we know about Omicron at the moment? I accept that Nick has said, for example, that we should just let it rip and get everybody infected. But what do we know about Omicron at the moment?
So, Nick Coatsworth, here's your right of reply. What do you say to that?
Oh, well, it's not an easy thing for Chris to be put to Chris in a News Breakfast interview. I've never said we should let COVID-19 rip, and I think that's an example of a very easy thing to say in response to really what was a comment on my behalf that reflected on the AMA's expressed concern that the government wasn't doing enough for the booster program. We are 4 weeks into the Omicron variant. To suggest that we are in any way behind on the booster program is, in my view, an irresponsible contribution to increasing fear amongst the Australian population. And I think the AMA can do a lot better than that and should consider itself more responsible in its commentary and act like true partners in this battle rather than sort of political opportunists.